The Student Assistance Program, or more commonly referred to as SAP. SAP has been in existence for 37 years. It is mandated by the state of Pennsylvania to be in every school. The goal is for the school to work collaboratively with the student, family, and community. What is SAP? SAP is a multidisciplinary school-based program that aims to identify those students who may be experiencing a variety of behavioral or academic difficulties that may be posing a barrier to their academic success.
Who is on the SAP team? It is a team of school personnel and behavioral health community liaisons working together to identify and address concerns that may be interfering with a student's ability to be successful in school. The SAP team have all received specialized training in providing student assistance program services from the Pennsylvania Department of Education and are trained to understand issues of mental health and chemical use, abuse, and dependency. What does SAP do? They assist families in accessing school and community resources. SAP works to form partnerships, relationships with families. Families want to feel included and a part of the team. It is important to consult with the parents regarding their child's academic and behavioral concerns. And finally, SAP can provide an avenue for students to get the help they may need to be successful, helping to remove barriers. The SAP liaison can offer assessments, psychoeducational group counseling, and individual short-term problem solving.
What SAP doesn't do. SAP is not a first intervention. It should be utilized when internal school supports have been exhausted. SAP is not ongoing therapy. It is not mandatory. It is not a referral service. SAP does not replace other school programs, and SAP is not a crisis service.
What is the SAP process? SAP utilizes a four-phase process to help improve student success. First is the referral, which can be made by school counselors, administrators, teachers, staff, students, or parents. Next step is the team planning meeting, where referred students are discussed within the team. The third step is the intervention and recommendations, and this is where a meeting is held with the student and their parent or guardian in order to discuss any concerns and to recommend either in-school or community supports. The fourth and final step is support and follow-up so that the student's progress can then be monitored. What are some reasons for referral? Appropriate referrals to SAP are observed behaviors that may indicate possible drug and alcohol or mental health concerns, students who may be experiencing a loss, or noticeable changes that may cause concerns such as poor attendance, lack of motivation, change in attitude, academic or personal success. What are signs of possible substance abuse? Examples of this may be personality changes like irritability, being secretive, moodiness, or being withdrawn, productivity changes such as lateness or absence from school, not completing homework at all or on time, or sleeping in class. Some physical changes might be weight loss or weight gain, frequent cold-like symptoms, bloodshot eyes, or a change in energy. Examples of communication changes would be defensiveness when discussing potential drug use, or a deterioration of family relationships. And finally, changes in friends, clothes, or interests. So are students changing their clothing style? Do they change friend groups? Are they quitting clubs or activities? These all may be some signs that there may be possible substance use issues. What then are some signs of a potential mental health disorder? Some things to look out for are changes in personality, eating or sleeping, an inability to cope, increased anxiety or a depressed mood, an increase in anger, violence, or extreme mood swings.
What is the role of the SAP counselor? To identify high-risk students. Is this something that the school can address, or are outside services necessary? Make recommendations and assist the student and family in accessing these services.
What is the role of the parent? Parents are an integral part of the SAP process. They are there to give or deny consent. They have the ability to make decisions for their child. They have access to records, and their cooperation allows the SAP team to work together to help improve their child's success.
What is the role of faculty and staff? To be a major source of referrals to the team, you are, as they say, on the front lines. When making referrals, cite observable behaviors. You may also be asked to complete observable behavior checklists on a student who has been referred. What are observable behaviors? It is important that we report only observable behaviors and not opinions. Julie threw her phone at Isaac. Yes, it is observable. John is not popular. No, not enough information. How did you draw this conclusion? He may be very popular outside of school. An appropriate observation could be John sits alone at lunch every day, for example, or has stopped interacting, walking with friends. Is SAP confidential? The entire SAP process is confidential with a few noted exceptions. If the student is thinking about harming themselves or harming someone else, or if someone else is harming the student, in which case that information would need to be communicated. It is completely voluntary. It can be stopped at any time. The process is designed to support students and families and is not disciplinary in any way. The information gathered on students through the student assistance process is confidential as well. The team needs to ensure that this information is not exposed to others who have not been trained and who are not on the team. You may not always be kept informed as much as you would like after submitting the referral. However, rest assured your referral is being addressed.